Okay, further laboratory evaluation of this patient is most likely to show presence of which of the following antibodies? Okay, let's read that question. A 53-year-old man comes to physician for 3 months of history of non-pruritic rash, fatigue, decreased urination. Okay, decreased urination is oliguria, and there is physical examination shows multiple erythematous purpuric papules on the trunk and extremity do not blanch with pressure. Okay, purpuric papule does not blanch. Okay, it's called palpable purpura. Purpuric papule and then do not blanch with pressure. It's called palpable purpura. Okay, palpable purpura, oliguria, fatigue, and creatinine is increased. Urine analysis shows red blood cell and cast and protein. Okay, the patient has red blood hematuria, red blood cell cast, proteinuria, elevated creatinine, and palpable purpura, fatigue, oliguria. Renal biopsy, okay, serum complements also low. Renal biopsy shows subendothelial complex deposit with granular immunofluorescence and tram-tract basement membrane splitting. Okay, tram-tract basement membrane splitting and also subendothelial immune complex deposit is usually seen in a form of glomerulonephritis, nephritic syndrome called membranoproliferative glomerulonephritis. Membranoproliferative glomerulonephritis. In this type of glomerulonephritis, we have in a biopsy we have subendothelial immune complex deposition plus tram-tract basement membrane splitting. Okay, this patient has which of the following antibodies? Which are the following antibodies? Okay, no, one of the conditions that are related to membranoproliferative glomerulonephritis is hepatitis C. Hepatitis C can cause membranoproliferative glomerulonephritis. Okay, how? You know, the patient develops antibody against antigen of hepatitis C. Okay, that antibody with antigen come together in the glomerule and attract the complement. When a complement is attracted, it's called immune complex. That immune complex activate neutrophil, and neutrophil can cause vasculitis, damage of the glomerule. This develop glomerulonephritis, which is called membranoproliferative glomerulonephritis. Again, antigen and antibody against antigen of hepatitis C virus and antibody against it came close together and deposit in the activates the complement and deposit in the glomerule, the small vessels of the kidney. Once they deposit, is called immunocomplexes. Immunocomplex attract neutrophil. An immunocomplex attract neutrophil, then neutrophil destroy the glomerule and cause inflammation. It's called membranoproliferative glomerulonephritis. Okay, and the right option is here anti-hepatitis C antibody. That's why if someone develop membranoproliferative glomerulonephritis, we should consider that maybe the patient has hepatitis C, because hepatitis C is related to membranoproliferative glomerulonephritis. Okay, what about choice A, anti-desmoglein antibody? In which condition we have anti-desmoglein antibodies? Is a skin problem, autoimmune skin condition. Excellent. Pemphigus vulgaris. In pemphigus vulgaris, we have antibody against desmosome, and in the skin, and the skin become bullous. There's lots of bulla, or I mean blisters in the skin. And what about choice C, anti-DNA topoisomerase antibodies? In which condition we have this anti-DNA topoisomerase antibodies? In systemic sclerosis, or sometimes it's called scleroderma, we have anti-DNA topoisomerase antibodies. Anti-neutrophilic cytoplasmic antibody, this one is seen in lots of forms of vasculitis. Anti-neutrophilic cytoplasmic antibody is seen in, I think, in Wegener granulomatose and also in the microscopic polyangiitis. In this condition, we have this antibody. Anti-cordyolipin antibody we have in a condition called antiphospholipid syndrome. In antiphospholipid syndrome, we have anti-cordyolipin antibody, anti-beta-2 glycoprotein antibody, and there's 3 antibodies: anti-cordyolipin, anti-beta-2 microglobulin, and also anti-lupus anticoagulant antibody. Okay, these people have recurrent miscarriage and also recurrent thromboembolic events. Okay, the right option is choice B here.
Thanks for watching. Please give a thumbs up and subscribe for more.